Welcome back as we talk about health news this midday. And historically, cancer has mostly occurred in the 6th or 7th decades of life. But recently, the rate of cancer in younger adults has been going up. The American Cancer Society reports that cases in 40-year-olds, 30-year-olds, even in some 20-year-olds has been increasing each year. Our medical expert, Dr. David Winter of Baylor Scott & White, joins us today to talk more about this trend. And Dr. Winter, appreciate your taking the time today. What reasons would the medical community offer for why we're seeing more cancer occurrences in younger folks?
Yeah, Mark, we're not exactly sure what's going on there, but some of the speculation is around ultra-processed foods, maybe plastics, maybe something else in the environment. We're not really sure. More research is needed. But there are some things you can do to lower your risk of cancer. That includes regular exercise, eating lots of good vegetables and fruits and whole grains, avoiding all tobacco products, minimizing alcohol, and getting regular checkups. Those things can actually lower your chance of getting cancer.
We know that those things, as you mentioned, can help. Are those the kind of things that you need to have started a while ago, or is it never too late to begin?
Yeah, it's never too late to begin. They have other benefits also with heart disease and strokes. Also, genetic factors, though, can be important. So if someone in your family has cancer, be sure that your doctor knows about that. He or she may want to do additional testing for that. There's also blood tests that can help be a marker. If you have the BRCA gene, BRCA gene in your bloodstream, that increases your chance of getting breast cancer for women, prostate cancer for men. So testing with blood tests can also be helpful.
Now, Dr. Winter, we did a series here on the WFAA recently about SADS, sudden cardiac arrest, and one of the things we talked about in that series was genetic testing, and you kind of mentioned the genetic aspects of cancer as well. Is that something that you recommend people consider asking their doctor about?
Yeah, it's a consideration. Right now, it's somewhat, I say it's in its infancy. It's been around for many years now, and sometimes it's helpful, sometimes it's concerning. I would say if you do these yourself, then be sure that your doctor can look at that with you and help make some decisions about how you need to change maybe some of your habits that you're doing. So they're reasonable. I'm not sure they're mainstream right now. Most doctors don't do them in their office, but it's something to consider, Mark.
We talk about, folks seeing increased rates in younger ages. If you are someone who gets one of those diagnoses, how would you comfort one of those patients about the prognosis and the medicine available to them, some of the treatments that maybe weren't available in decades past?
Yeah, early diagnosis is key. For example, breast cancer, early stage breast cancer, almost 95% chance of a cure. Late stage breast cancer is often deadly. Same with colon cancer. You catch it early, you can cure it. Late stage colon cancer doesn't seem to do as well. Now, the Youth Preventive Task Services, they actually change when we start doing screening. It used to be 50 for women with breast cancer. Now they've dropped down to 40. And most recently for colon cancer, for both men and women, they dropped the screening to begin from age 50 down to age 45. So screening and catching cancer early is very important.
All right, so try to stay healthy and don't skimp on seeing the doctor. Some great advice as always, Dr. Winter. Appreciate you joining us today.
Thank you, Mark. Good to be with you.
All right.